It's here, on this very spot, a monument built on the backs of men and women who served in the First World War. A hospital for returned servicemen. Humble beginnings eventually grew and evolved into the rich, diverse health service we see today. But what is it that makes this such an integral part of our community? Join me on a journey as we discover its rich and diverse history. Welcome to Seymour and District Memorial Hospital. 100 years of serving our community.
I haven't been around for the 100 years, been around for the 80. It makes me feel, it's important to the town. It's important because it's a military town and a lot of people are very proud of the hospital. The hospital, I think, was first called the Soldiers Memorial Hospital. And the former members of, I think, the local community who had served overseas were instrumental in setting the hospital up, and they wanted something in memory of those who had served.
Well, it was before the RSL was built that the ladies of the returned servicemen were the ones that drove the original concept. And they're the ones that pushed to get a hospital. So it was very important for them to get the families, local families back then, involved on getting the hospital up and running. Initially it was mainly servicemen that were in the hospital, getting looked after. The history of the gates is pretty comprehensive actually. The RSL's been involved with the hospital from day one. I got involved with the RSL, then looking at the gates here. We pulled them down, welded them back up, re-galvanised them and hung them back up again. From there we then formed a committee to upgrade the memorial itself to enhance what was a car park out the front. And that is now, as you see it, with the Bluey the soldier. The roses, the lone pine tree, and if you have a look around the glass panels, it's all local soldiers that are involved in that.
That is sort of the story, the Seymour story. So, we are very fortunate in this area with our setup, and I'm sure the people of Seymour appreciate it too.
We've always had such a community spirit. Most of us live within the community. There's always been a really big focus to provide for the community.
You do sort of know everyone. You know a lot of the staff that work there, and you know that level of care is going to be high, and it's that whole comforting feeling knowing that if something happens, you feel like you're being looked after by family.
My husband was a patient in the old Barrable, and so I went daily. This is the first time I've been a patient, and it's better than I expected. Everyone through the kitchen staff to the cleaners to the nurses, all excellent.
It's been such a privilege to be able to care for the people in Seymour. You know, we've made some lasting relationships with people that we care for. You know, they recognise that there are so many services here that they can access without having to go elsewhere, and their willingness to embrace their local hospital.
Well, the hospital was is a small regional hospital. It sort of had 28 beds. We used to look after paediatric patients, obstetric patients and general care patients. And the services that are provided by the Seymour Health has been expanding all the time. You know, it's gone from having a matron, and I think it's helping the community deal with many different aspects of their health.
You know, what I've learned about a small community hospital is that it's about teams. It's not just about the nursing medical staff. It's about, you know, our hotel services. It's about our kitchen staff. All these nurses were the building blocks of the nursing foundation within this hospital. There's a community within a community. We belong to the community. You know, Seymour Health is, we belong to the community, but we have our own community within that.
The staff of Seymour Hospital are our community, and our community are also our staff. Life governors are appointed in recognition of their outstanding contribution. Did you know that the hospital's got over 100 members of our community who've been awarded that recognition? And the list of these life governors are published every year in our annual report. The contribution of our community to the hospital has been invaluable now for over 100 years. The connection between the community and the hospital and how valued that is. How much trust there is of the community in the hospital.
And I can remember coming into the original building, and you just sort of weren't sure where you were meant to go. Like, you'd walk around and you'd think, oh, if I go through that door, then I'm out in that corridor, but you weren't sure how to get back. Like, it was, so certainly a big improvement, and yeah, it's hard to believe that it's been going for 100 years, really.
I think it shows that we're here to stay. You know, there's been some significant structural improvements in the hospital over the years. It's good that we're not marking time, that we're keeping up with the times by being able to upgrade facilities and provide a safer environment for people. You know, the new entrance to the hospital is much better than what it used to be.
So many people throughout the organisation that have built those foundations for this 100th birthday. And so, you know, we have to recognise that we're only part of something that's such a big whole. Yeah.
It's pretty cool that it's been around for that long. It sort of makes you feel, yeah, well, there's certainly that history, and definitely the connection to the military, like, sort of was what grew it into what it is today.
Oh, most important for Seymour, the hospitals in Melbourne are not half as good. That's my opinion.
don't celebrate things, you tend to forget them. And if you forget the past, you're not going to go ahead. It's simple as that. You've got to learn from what's happened in the past.
All we see are bricks and mortar, but you don't need to ask what is its purpose. Its purpose is always found in service. So to you, the nurses, the allied health, community service, the staff, doctors, caregivers, the cleaners, the cooks, the board directors, the admin team, the healers, the helpers, and our volunteers, we thank you. To you and to the community of Seymour, thank you. You have given us much more than just the ability to serve.